So, we are going to be starting the cardiovascular system and we'll begin with the heart. So, to start, we have some fun facts about the heart. Really interesting stuff. The heart is going to be beating about 100,000 times per day, which equals 35 million beats per year, which then equals about 2.5 billion times in your average lifetime, which is just absolutely crazy. Now, it is responsible for propelling blood through about 60,000 miles of vessels. There is 60,000 miles of vessels in your body. Okay, that's so weird to think about, but we'll talk about how that's possible. Not in this chapter, but in the next. And then it is going to be pumping about 5 liters of blood per minute. It can pump 30 times its own weight each minute. That's crazy. Okay, so these are some crazy facts about the heart and its functionality. So, in this chapter, we're going to be going over unique properties that allow it to have this will sustain a lifetime and do this much work throughout that lifetime. All right. So, let's talk about where the heart is actually located. We got to go back to uh, our introduction chapter when we were looking at the body cavities. Remembering in the thoracic cavity, we have the mediastinum, okay, which was this center portion of the um, thoracic cavity, okay? So the heart, you can see, is in the midline deep to the sternum and then kind of projects itself more left, okay? It is a cone shape, and it should be about, on average, the size of your closed fist. So if you close your fist, make a fist, you can kind of get an estimate of how big your heart should be. Okay. And so again, it's in the mediastinum, and it is going to be, because of this cone shape, it is going to be kind of veering off towards the left. So 2/3 of its mass is on the left side of your body, right? So, keeping in mind, within the mediastinum, there was the pericardial cavity, which we stated was where the heart was in a previous chapter. But really, it's in the mediastinum that is the true cavity of the heart. And we'll talk about why that is in a moment. Now, some other things to notice on the heart is the apex and the base. So when you probably hear these words, you think apex would be maybe superior and the base would be inferior. However, on the heart, it is the opposite. Okay. So the apex is going to be that cone shape, right? Where it gets its cone shape. So where it kind of tapers off on the left side, that is going to be the apex. Okay, so you can always identify the apex, or rather the left side, or kind of orient the heart really by making sure that that apex is on your left side. Um, and of course, it should be pointing more so anteriorly. It does kind of project anteriorly and again inferiorly. The base, on the other hand, is going to be the top portion, the superior portion, and it does kind of sit a little bit more posterior compared to the apex. So in lab and on the models and cadavers, you may be able to kind of see that there's like an angle as it comes inferiorly towards the apex, and it'll be angled towards the anterior side. So just orienting yourself with the base and the apex and understanding all of these great vessels are going to be kind of extending off of the base. That's going to help orient the heart, and you'll be able to determine right from left, right? So this would be the right side, this would be the left side, and you'll also be able to determine anterior versus posterior. Okay, so here we have the heart sitting in that thoracic cavity, in that mediastinum region, right? So we can see the mediastinum is going to be that center region between the lungs and deep to the sternum, right? So the lungs are going to be sitting on either side, and we can see that. the left lung, we'll talk about it when we get to the respiratory system, but it does have this specific marking called the cardiac notch, and that is to allow for the apex of the heart to kind of come in that left direction. Okay. On the heart, on the cadaver image, we can see a lot of loose adipose connective tissue covering what we call the epicardium. So basically the surface of the heart, right? And we can see how the heart is sitting right on top of the diaphragm. So it is superior to the diaphragm. All right. Soon you'll be able to label all of these structures with ease. And here we have a view from the transverse plane looking superiorly. So it's like we're sitting at the diaphragm, right? So we're able to look up and see the heart, see the lungs on either side. We can see the vertebrae in the posterior position. All right. We can see the pleural cavities surrounding the lungs, right? And we also have that pericardial cavity surrounding the heart. Again, we'll talk about how that's not the appropriate location of the heart. It is the mediastinum that the heart sits in. That is the region, that's the cavity. Okay. And here we have it again on another cadaver image. I believe when we get to see the cadavers in lab, everything will kind of be cut and things will be removed, or you'll be able to remove the heart from the body cavity. So it's a good to see everything kind of intact. With in this image, we have the pericardial sac, that serous membrane, completely intact here, and we can see how it kind of fuses with the diaphragm, which we'll talk about momentarily. All right. So the pericardium, right? The heart is in the mediastinum. That is the anatomical region that it belongs to. All right. It's going to be above the diaphragm, between the lungs, okay, deep to the sternum. But the pericardium is referring to the membrane that is going to actually be surrounding and protecting the heart. And that's what we can see in this image here, right? So we've talked about the serous membrane that is going to be surrounding the heart. And that's kind of shown with the with the pink lines here. Okay, so we would see the serous pericardium, right? So that's how we would write that out, and we would call it the parietal pericardium and the visceral pericardium. Remember, the visceral layer is what's actually touching the organ, and the parietal layer of the membrane is going to be facing the outer wall. But in the pericardium, there's also this fibrous pericardium, which is not a part of the serous membrane. Remember, the serous membrane is a double layer membrane around the heart, parietal and visceral layers. This is just an outer fibrous layer made of dense, irregular connective tissue. And it's really just kind of like a bag that's going to be the portion that attaches to the diaphragm. So again, it's going to attach to the diaphragm. It positions and anchors the heart in the mediastinum. It's obviously going to be protection. But cool thing is that because it fuses to the diaphragm, it's actually going to connect onto the central tendon of the diaphragm. And so when the diaphragm contracts, when you take, a deep breath in, right, that's actually going to kind of help move the heart as well to facilitate movement of blood. So fibrous pericardium, this outermost layer that's not a double layer or anything, it's just going to be like a bag that the whole heart sits in, fuses to the central tendon of the diaphragm, and obviously protecting, anchoring, but also kind of helping with movement of the blood. Okay. Now, between the two layers of the serous pericardium, right, the parietal layer and the visceral layer, there is the pericardial cavity. So this is the cavity that we've been kind of maybe, throwing around that term, pericardial cavity, right? So technically, the heart is in the pericardial cavity, but that's not the correct region that the heart is sitting in when we look at our body cavities. The pericardial cavity is really just formed by that space between the two layers of the serous pericardium, that serous membrane, right? So in the in the pericardial cavity, there is pericardial fluid, right? So this fluid is going to help reduce friction when the heart is continuously contracting and moving around. And that's going to be, this fluid gets secreted from pericardial cells. So that's kind of the secretory lining, right? So there's these cells that are going to be secreting this fluid, like a lubricating fluid that, again, reduces friction. And that fluid will be sitting around in the pericardial cavity. All right. So when we're looking at the heart, we can see the pericardium here, right? And the pericardium here is referring to both the fibrous and the serous pericardium. So this outer portion of dense irregular connective tissue, that's the fibrous pericardium. And then as we move deep to the heart, right, into the heart, we have this layer right here, and that is going to be your parietal pericardium. Okay, that's the first layer of that double layer serous membrane. Okay, and then we have this space, and that space is where we have the pericardial fluid, and that's what we actually call the pericardial cavity. And then going right onto the actual heart, the outermost layer of the heart is the visceral pericardium. Now, on the heart, we actually have another name for that, and that's the epicardium. So the epicardium is, again, the outermost, it's the visceral layer of the pericardium. But to be more specific, we can call it the epicardium. Okay. And that's going to be composed of mesothelium tissue. And then there's also going to be some elastic, tissues, as well as adipose connective tissue. Okay. And then we can see, so we have the epicardium or visceral pericardium, great. And then we go into the actual heart, like wall, essentially, the meat of the heart almost, and that's referred to as the myocardium. And that is going to be where cardiac muscle tissue is found. Okay, so this is where we have that actual, tissue that's going to be contracting and pumping the heart. So 95% of the heart wall is myocardium, is cardiac muscle tissue. And it's kind of arranged in interesting bundles, kind of like swirly with all of these branches. And that's, again, to have better pumping abilities. Okay. And then the most internal layer of the heart wall is the endocardium. And this is going to be just a thin layer of endothelium with some connective tissue below it, right? And this is just going to be, it's a really smooth layer of the heart wall, and it's really just reducing surface friction as blood is pumped through the internal chambers of the heart. And here we can see it on the cadaver. So we can see the epicardium or the visceral pericardium. We see the myocardium, that muscle cardiac muscle tissue. And then we have this internal, the deepest layer, which is the endocardium, very smooth, reducing friction inside the heart. You can also see loose adipose connective tissue, that fat sitting on the epicardium. Okay. And really, the amount of fat varies between individuals, and that just kind of goes back to the individual's lifestyle. But there is always going to be some bit of adipose tissue on the heart, specifically around the chambers called ventricles, just because that's where there's a lot of cardiac vessels. Okay. Um, all right. And just to show us again, the pericardial cavity, right, which is the space where the fluid is flowing, okay, and it is a bilayer membrane, right? And so when the heart sits in it, it kind of bulges over, giving us that bilayer effect where we have the parietal layer on the outside, right? And the visceral layer connecting or touching directly onto the heart. Okay. So on the cadavers, or if you ever get to dissect a heart, when you take the pericardial sac off, the pericardium sac off, you're really just kind of cutting right here, and you're taking the parietal layer off, right? You're not necessarily taking the visceral layer off because that's the epicardium. That's the outermost layer of the heart. Okay. But again, that pericardial cavity is really just referring to that space between the two layers of the serous pericardium, the serous membrane.